Thank you very much, and I do consider it a great blessing to be here to talk to you about this topic today. I'm going to be discussing 5 steps to securing our blessings of liberty to practice Hippocratic medicine. The first is creed and deed. Know what you stand for, stand unwaveringly, live your life accordingly in word and deed. Know what stands against you, stand against that unwaveringly, live your life accordingly in word and deed. The struggle for the soul of health care began with Plato, the ancient Greek philosopher who urged that doctors refrain from curing the weak and infirm to improve society, versus his contemporary Hippocrates, who felt physicians worked on behalf of the patient, not for the good of the state. This struggle continues to the present-day debate over healthcare rationing to control costs. If government's the primary payment source for healthcare, then the physician becomes essentially an employee of the state, and whoever pays has the power to choose. I met Hippocratic Dr. C.L. Gray on the healthcare battlefield in San Antonio, Texas in August of '09. We work together to this day. Hippocrates' Proteges, the doctor's doctor, the most influential physician in history, considered by many physicians, is Sir William Osler. He emphasized clinical experience, bedside manner, going on rounds. Listen to your patients. They are telling you the diagnosis. The practice of medicine is an art, not a trade, a calling, not a business, a calling in which your heart will be exercised equally as your head. One of Hippocrates, Osler's, and Cushing's proteges is my father, Dr. Story, who was introduced earlier. A self-described teacher, he was chairman of neurosurgery at our medical school for 30 years and ultimately went into private practice. I found these remarks from his 80th birthday in a brochure that was honoring him. And he says, "You must pursue the study of the basic sciences with a vengeance. They are key to understanding." And he also echoes what is said by Sir William Osler about the importance of compassion and listening to your patient. Do not make medicine a trade. And then ultimately be involved in local, state, and national policy. Team Hippocrates grows, and Team Hippocrates is where physicians serve the patients. I learned from my father to honor the tradition, serve the sick, advance the field. And my daughters, 2 of whom are physicians now, have learned this from me. All of us being through a rite of passage to acquire a sacred knowing. And we hope to continue to recruit the very best. On the other side is Obamacare's most influential physician, Dr. Ezekiel Emanuel, a bioethicist of all things, an oncologist who's a world expert in rationing, death, and dying. He espouses Plato's principles. He created the complete life system of rationing, complete with the Grim Reaper curve. Innovation and Hippocratic oath are too expensive, according to him. He's currently a senior fellow at the Center for American Progress, and we all love this article from the Atlantic, where he says why I hope to die at 75 and hopes we will all check out gracefully too with him. This is where the physicians serve the state. As Plato's protege, Dr. Emanuel served as Obama's key healthcare advisor on the Affordable Care Act. He bemoaned that doctors take the Hippocratic Oath too seriously as an imperative to do everything for the patient. He believes true reform includes redefining doctors' ethical obligations. He believed medical students should be trained to provide socially sustainable, cost-effective care instead of thinking only about their own patients' needs. Another Plato protege, Dr. Don Berwick, was Obama's first head of the Center for Medicare and Medicaid Services. He opined that the federal government must step in between doctors and patients to curb and redistribute the use of medical resources. He said groups, not the individual patient, should be the unit of concern. He loves the British system of NHS, and he believes that healthcare is a common good, single payer speaking and buying for the common good. This is very telling. He said, young doctors and nurses should emerge from training understanding the values of standardization and the risks of too great an emphasis on individual autonomy. So what about Team Plato? What is their battle cry? Is it defame the tradition, serve the state, and stagnate the field? And then with the 2008 election, the perfect storm emerged. President Obama, along with a Democrat House and Senate, got right to work. And he said, this was the most chilling thing I heard, and I've found where this comes from in the law. At least we can let doctors know, and your mom know, that you know what? Maybe this isn't going to help. Maybe you're better off not having the surgery, but taking the painkiller. At that point, I found a colleague. We joined together and we formed American Doctors for Truth. We actually made an ad, a parody ad of this, showing President Obama, not Paul Ryan, throwing Granny off the cliff, but we showed the doctor saving Granny. Because we follow the Hippocratic Oath, which is an oath of professional behavior sworn by new physicians attributed to Hippocrates. This is actually the oath that I swore and my daughter swore at our medical school. The AMA, on the other hand, believes in living changing ethics, and their current code is a living document, updated periodically to address the changing conditions of medicine. Whose code of ethics do you follow? Is erasing and rewriting them, as per the AMA, government and third party, a moral and virtuous option? And what does the Constitution tell us? We, the people, in order to secure the blessings of liberty to ourselves and our posterity, ordained and established our Constitution. Thomas Jefferson says of liberty, it is unobstructed action according to our will. However, rightful liberty is within the limits drawn around us by equal rights of others. He does not add within the limits of the law, because the law is often but the tyrant's will, and always so when it violates the rights of an individual. And our freedom is only secure as long as we are willing to fight for it. Thomas Jefferson and the founders believed that virtue was the essential element of liberty. If the people lack virtue, no government can rescue them from tyranny. Virtue is moral excellence, righteousness, and responsibility. As de Tocqueville said, America is great because she is good, and if America ever ceases to be good, America will cease to be great. Jefferson wrote to John Adams in 1819, pontificating the demise of the Roman Empire. No government can continue good, but under the control of the people. And their people were so demoralized and depraved as to be incapable of exercising a wholesome control. Are we as a people presently so demoralized and depraved that we are incapable of exercising control over government? Depraved, morally corrupt, debased, perverted, wicked, crooked, distorted. Our founders were so wise, they knew that the proper role of government was to provide equal rights, not equal things. And their approach was through a freedom to prosper for all, that man's instinctive will to succeed in a climate of liberty would result in the whole people prospering together. The poor could lift themselves up through education and individual effort to become independent and self-sufficient. Hard work, frugality, thrift, and compassion are key words of the American ethic. Samuel Adams said the ideas of a welfare state were made unconstitutional. Instead, we had calculated compassion. There was a mandate from God to help the poor and the underprivileged, but we needed to help them help themselves. And where emergency help is provided, don't prolong it to the point where it becomes habitual. We also had founding principles of fixed responsibility, starting with the individual and ending with the state only in times of disaster and emergency. By doing this, the founders felt that they were protecting the unalienable rights of the people from abuse by an over-aggressive government. There's no constitutional authority for federal government to participate in charity or welfare. We all know our unalienable rights that are enumerated, life, liberty, and the pursuit of happiness, but there are many more. And we need to realize that we have the right to own, develop, and dispose of property, the right to make personal choices, have a free conscience, choose a profession, enjoy the fruits of our labor, improve our position through barter and sale, contrive and invent, the right to privacy, the right to personal security, free association, and the right to contract. If we look at what our principles of freedom are, we cannot stay free unless we remain a virtuous and moral society, and we must be strong. And to do so, we must elect virtuous leaders. Highest level of prosperity occurs when we have a free market economy and a minimum of government regulations. The burden of debt is as destructive to freedom as subjugation by conquest. Are our leaders moral and virtuous, and can we trust their word? Do we serve the patient, or are we demoralized and depraved, and do we serve the state? Tip 2, read and heed. What does the law say? Who's writing it, promulgating it, reading it, commenting it, and we must do this. We all know about 1965 when LBJ signed the Social Security amendments into law with the prohibition clause that said government would never interfere with anything we do. Well, of course, the government has not remained true to their pledge, in which the HMO Act, HIPAA, HITECH, ACA, MACRA, 21st Century Cure Act, and Bernie Sanders' dream of Medicaid for all. Government and third-party greed has supplanted patient need. Are we, the generation of physicians, acquiescing to the commandeering of our profession? How's this law fest working out? So far, not so good. Look where we are as physicians down on the bottom of red, and what the administrative explosion has done to $3.2 trillion a year, a fifth of our economy, for which we don't have the money, being spent in our name with a government mandate to buy it or face penalty. Isn't it interesting that following the 2008 election, within the blink of an eye, huge, over 2,000-page laws emerged, or bills emerged from the House. The initial one on the far left, I had occasion to read, and it's interesting that it really prompted me last night to think about technocracy. Where does this come from? And I think they've been working on this. It contains elements of MACRA. Ultimately, that one didn't pass. On Christmas Eve, how fittingly, Nancy Pelosi led in the dark of the night the passage of 3590. Shortly thereafter, in March of 2010, President Obama happily signed the Affordable Care Act, and look at the 20,000 pages of regulations that were spawned. Shortly thereafter, I had occasion to have what we talked about earlier, real-life medicine, not virtual medicine, and I became a cancer patient. And I had occasion to experience the physician-patient relationship from both sides. I also had the occasion to be a victim of untested EMR problems when I received another patient's medications who were errantly transferred into my chart. That's why I'm wrapped up there. I also had the occasion to be denied the greatest innovation. A female colleague of mine who's a breast cancer surgeon said, "Kris, send your tumor off and get this test." And of course, my insurance company said no, because we're victims of corporate medicine, which harms the patient, with delay, denial, restricted networks, formularies, games, a race to the bottom, and this has been well covered during this meeting. Real-life medicine also gives us a glimpse at the perverse billing system, which is money laundering for a cartel. And I think we should all save all of our bills, get them for our patients, and then we'll see what's going on. Because the Obamacare architects, and earlier on Team Plato, I had a picture of Jonathan Gruber, they bank on the stupidity of the American voter to create this convoluted system. But we can fix it. We can fix this intentionally bad law, and we need to get rid of these third-party interlopers. We've touched on the pharmacy benefit managers that deny our patients care. I've gotten a letter at this very group's meeting that I send out and say, my patients will have their meds, or you're culpable. ICD-10, what a joke. I happened to go to a meeting in DC, and I was going to fight ICD-10, and little did I know that the big problem was that MACRA was about to come on the scene. So this is a step-by-step loss of autonomy. Their delays becomes reality, and it's a losing game. We can't play this. It's just a tool for payment denial and targeting, so I don't do ICD-10. How does organized medicine help us? Well, mine, ophthalmology tells me if you can't beat them, join them. And they want me to buy courses so that they can tell me how to implement and comply with the insanity and perversity. And so came MACRA, the Medicare Access and Chip Reauthorization Act, which is a Trojan horse for the government takeover of medicine. I wondered where it came from, and maybe last night I'm going to do some exploration into this. I was struck by the similarities to China that wants to give all of its citizens a score, and their rating can affect every aspect of their life. And similarly in MACRA, they want to grade every physician with a grade of 0 to 100 in communist-style fashion and reward or penalize physicians. They have the audacity to put in the rule that they're doing this to drive physician behavior. The Composite Performance Score will be on the public website so everybody can go look. This is a state serving Marxist system in my mind. I don't write this, I just read it. And your score, here's a little way that they'll do this. There's 4 categories. There's quality, advancing care information, which used to be EHR, but it's much more Orwellian, nice to make it advancing care information, resource use, and clinical and practice improvement activities. There's a new committee that's formed, the PTAC, the Physician Focused Payment Model Technical Advisory Committee, and they have all these options, but there's not an option for having better outcome at higher cost. These are all perversely incentivized problems with respect to the patient and serve the state. MIPS, APMs. What the heck? Congressman Burgess, a fellow physician, Republican congressman from my state of Texas, is the one who sponsored this. As has been stressed here, words matter. We have to read the laws and rules because government wants to drive our behavior. Congress passes it, but the executive branch agencies rewrite it. So I read it. And it doesn't just include Medicare patients. It includes commercially insured patients too. All payers, not just commercial insurance and not just Medicare all. Not just MIPS data, non-MIPS data too. It's a total violation of privacy in the Hippocratic Oath. It's all in there. And the reason I show pictures is because people think I make this up. I have to take pictures of the law and show them what's going on because I believe it's our ethical duty to keep our patients' data from government, not transmit it to them. And this is frightening because in there, they decided that their own Office of Civil Rights, that it was okay if they transmitted our data and if we gave it to them. Stealth legislation by regulators is an unconstitutional abuse of powers, provides no due process, and tramples rights. Our government has codified their ability to collect data on all of us. They want to create, this is the word for word, to create a more comprehensive picture of the practice performance. We are also proposing to use all payer data where possible. And government wants to collect and keep the data on all patients for a minimum of 10 years to eternity. And look at an example of these perverse incentives if you don't believe it in the cost or resource use category. The physicians that spend the most on their patients get 0 to 2 points. The physicians that spend the least get 10 points. Can you imagine? So this is where I began reading, and with this group and several other physicians dissenting and writing to CMS. We wonder why 83% of physicians are pessimistic and less than 1% are optimistic. Because when it comes down to the patient versus the state, we don't have any help. Our AMA has been co-opted. The CEO, Dr. James Matter, a former dean at University of Chicago, worked with Michelle Obama and Valerie Jarrett. He loves single payer, and he represents the AMA, who of course less than 17% of physicians are members. So we must pursue truth, and that's why I created this compilation of daily dissents and sent them to CMS regarding my interpretation of the law. We must read and heed. We must use our freedom to serve others, speak truth. We must be strong, hold up a shield, and do what's good. Along this journey, I encountered Andy Slavitt, who was discussed earlier, who at the time was the head of CMS. And I believe that when he says that Medicare unveils far-reaching overhaul of doctors' pay, that this is the antithesis of the Prohibition Clause. The final rule had 2,398 pages, and when we met in person and locked eyes, we were on very different teams. Lincoln said we could trust the people to make wise decisions if we can get them the facts, the right facts, in the correct setting and context. And while we meet and talk, we must not make it sound like they are representing our wishes. Because while they did make some changes to MACRA, I think it was maybe lip service and pacifying us. So I asked, are you concerned about physicians and surgeons shortage? How about my colleagues who are walking away from the field and pursuing other careers, discouraging the next generation? He says, of course, and I welcome all serious concerns. I'm seriously concerned. We must be aware of the left's dangerous misconceptions, misuses of scientific data, and dismissal of older people as not worthy of the upkeep. Here's an example. Betsy McCoy, who's wonderful, in her book had an example of this, misleading data. Dartmouth did a 2008 study where they tried to prove that patients who get less care, fewer hospital days, doctor visits, tests, have the same medical outcomes as patients who get more. Read the fine print. They only looked at patients who died. They did not consider patients who recovered, left the hospital, and resumed active lives. And they do with everything. The U.S. Preventive Services Task Force does this with their recommendations on mammograms, breast cancer, PSAs. We must read and heed. We're no longer in the 1960s where we could pioneer and cut the chest and create save babies who were born with heart problems up in the University of Minnesota. I think we're more where Ayn Rand warned us, and we should reread what Dr. Hendricks, her fictitious distinguished brain surgeon, says about medicine. And when, if ever, we'll be able to enter again mainstream medicine. What are we doing when we comply with MACRA, when we do MOC, and so on? Are we enablers, conspirators, facilitators, and accomplices? Has patient need been replaced by state greed? Well, they can't do it without us, so let's not be the problem, let's be the solution. And so let's forge a new way. Let's lead the way there. That leads me to point 3. Let's lead and weed. We must be the solution, not the victim. We must stay alert and watch out for enemies and stand firm against them and weed them out. We must fight and bleed when necessary. We must speak and message effectively. And yes, we must cheerlead and rally. And that's why we're here, because that prevents demoralization. Leading and weeding requires time, travel, and expense, and your family often gets really mad at you. I remember one family vacation I was reading the Affordable Care Act, and I about lost my entire family who thought I was bizarre. But some of us are called to do things that we don't understand with special talents and gifts. I don't know why I'm inclined to read this. I wish I wasn't. But we must seek knowledge and wisdom. We must seek innovators and pioneers and cheerleaders and continually ask, does this serve the patient or the state? So I went to Surgery Center of Oklahoma, and I met and know Keith Smith, trying to forge a new way in San Antonio with fellow physicians to do transparent free market medicine where I relate directly with my patients. Instead of spending money on EMR, I bought and leased a really cool laser to give my patients the most innovation in cataract surgery. And then I completely severed all third-party agreements on October 1st, 2015. Every practice is different. Be creative, be bold, don't think you can't do it. I'm the one who sees the uninsured, the badly insured, the rationed. I also see celebrities, dignitaries, and medical tourism, people that choose to see me. And 2 weeks later, life changes again with real-life medicine in the blink of an eye. And here's my daughter, a cheerleader at UT, who's in a terrible wreck. And thank God for real-world doctors and our teams of professionals that healed her ruptured spleen, her liver, her kidney, her bones, her insides, her face, and she's smiling in the ER. And I learned from the obscene bills that we must stop the insanity because the system is sicker than the patients. And when her bill was over $100,000, but the allowable was only $40,000, we know that there's subsidies and things are going on and money's going under and over and around the table and not to the patient. We must glean long-term vision from real-life lessons, and we must forge a better way. One thing we learned about Haley was that IV Tylenol worked great. A year later, she married. It was wonderful, and she returned from her honeymoon in another medical crisis on Christmas Eve, went to the ICU with terrible E. coli sepsis on her deathbed. And she made it because of our amazing physicians who do miracle work. But now, against, a year later, more odds, we have got to get rid of this corporate practice of medicine. It needs weeding. She was not allowed to have IV Tylenol because of a hospital policy that you couldn't have it in the MICU, only the SICU. So instead, with a fever of 105 and agonizing pain, she was given Dilaudid, which is an opioid IV that doesn't lower your fever. She was given IV Phenergan, which sclerosed her vein and gave her venous thrombosis in her right arm. And she was offered 325 milligrams of PO Tylenol, which she could not keep down. This is insanity, and we must protect our patients. How ethical is it when we go along with this? My world, third-party free, I am now seeing third-world pathology and suffering in my practice in San Antonio, Texas. I have working people coming in at age 60 years, blind with light perception-only cataracts because they don't get the Obamacare. They can't afford it. And they come in when they can't see. We have perverse incentives going on. My colleague, when you don't get paid enough to do the surgery and you're getting scored, who wants to risk a difficult case like this where you might get dinged? Well, I don't have to get scored. I'm going to get a 0 already. So I do these patients. It's inordinately challenging. It's very gratifying. But it's very ironic that I'm the one not playing. What's wrong with this? So we all know about the billing game. Here's a patient who contacted me with a $100,000 bill for inpatient retinal detachment surgery, which could be done for $5,000. So we've got to fix this. MACRA and MOC are intended to drive our behavior. Remember, we have unalienable rights of conscience to resist this. We need to seek moral and virtuous leaders. We need to weed out leaders who don't honor their word and who sponsor bad legislation. And I look forward to challenging Dr. Burgess, not me, finding someone, please, in Texas to challenge Dr. Burgess. We must read, write, and repeat, get the truth out to people who are smart, message effectively, network, and use social media. This isn't easy. This professed leader of medicine, Bob Doherty, senior vice president with American College of Physicians, blocks me. He blocks Meg Edison. We must unite and expose them. Dr. Meg and I, a pediatrician, we're very scary people. Yesterday, just here, I had to wear my full armor shield because a couple guys were reacting to some of my tweets about AAPS, and they said, by definition, they're talking about me, I'm okay with tens of millions being sick and dying because I'm vile. My worldview is appalling. My ignorance would make a mockery of the Hippocratic oath and disgust Jesus. That's who I am in these people's eyes. So that's why I form relationships with colleagues like Dr. Jane Hughes, who writes in the Wall Street Journal for Solutions. We have a template reform with American Doctors for Truth. I speak at the Let My Doctor Practice group. We have groups of us all around. I go to DC for the National Physicians Council with Healthcare Policy and meet with doctors like Vanilla Singh and Marcy Zwelling and Vicki Wool's here. And we must lead and weed. And look, there's Andy. We must get together with our wonderful legal colleagues and our patients, and we must repeal these bad laws like any other industry. We must engage and work with moral and virtuous people, and I'm standing next to Dr. Claire Gray, who I met back in San Antonio years ago. And I'm surrounded by dear friends, Alita Eck, Dr. Jane Hughes, my great role model, and many others as we try to do what's right for our country. We must fight at the state level. Thank God for Jeremy and Sheila Page, and all I do is stand up and try to look tall in the back row. But we can win wars if we work together. The AAPS is the ultimate resource, the ultimate protector, and we must use them. Finally, we must feed and seed. We must involve ourselves in medical and student and resident education. We must be their mentors and teachers and show them why Team Hippocrates is better than Team Plato. Here I am pregnant with my second daughter, who's now a physician, with one of my residents who has 5 children, 2 of whom are physicians. My tuition at that time was $400 my senior year of med school, including my books and my diploma. Now it's quite a bit more than that. Here's Heidi, who grew up to be quite a wonderful doctor. Here's the day of her medical school graduation, from being quite the princess. It's very sad because she's now under a new curriculum at our school. My oldest daughter had the old curriculum. She has the new one that's based on teams and the new MCAT, where it's less about science and it's more about socialist views and programs. We need to realize that our points of self-regulation begin with selection to medical school and end with lifetime certification. And we must not subject these people to test abuse. We must go on character, which must be virtuous, moral, compassionate, courageous, and that's who she is. Here's my other daughter, a chief resident in dermatology, working on ICD-10, the EHR, MIPS, prior authorizations. They do the prior authorizations instead of going on round and gleaning clinical experience. Doctors are not the tools of the hospital as it plays the cartel games. Here's my young associate on the left. Of course, her name's Dr. Young, which makes me Dr. Old, but that's okay. We must still teach and value individual life, individual ownership of the patient, not shift work or shifting responsibility to a team. And here's my 2 girls working together in the hospital that I trained in. We must grow Hippocrates' next generations of protégés. Feed and seed. The physician serves the patient, and I'm thankful that I was taught that. We must not relinquish our duty to non-doctors. We must not give our profession away. My own niece traded in her OB-GYN and chose a nurse midwife because she looked away from the screen. We've talked about the fact that we are not providers. We are physicians. So finally, deed, heed, weed, feed, and repeat. Opt out of entire government insurance model for direct patient care as soon as you can. Free your patients to choose this path. Use rules in the law to get rid of out-of-network status and separate deductibles. Allow choice for Medicare patients. Absolutely repeal MACRA. And weed its sponsor, Dr. Burgess. Don't do MIPS. And protect the Fourth Amendment right. We're the gatekeeper. Here's my baby daughter on top. I've taught her to creed, read, lead, seed, and repeat. We must empower the states. Repeal the individual and employer mandate. Make all health care expense, especially payments for health-sharing ministries and health savings accounts, tax-exempt for all. We must expand health-sharing ministries and allow in-office dispense of drugs to our patients, allow pharma to innovate new models, and allow physician ownership in hospitals and surgery centers again. We must cultivate and foster policy to grow direct patient care, promote innovation, promote competition, promote price transparency, allow a broad range of plans, including catastrophic plans, and replace these bad politicians. We must not become demoralized. We must not become depraved. We must be virtuous and morally strong. We must elect virtuous and strong leaders. We must honor the oath to our profession, and we must remain strong. We must not do MOC, no national licensure, no single payer, no replacement by mid-level practitioners, and no prior authorization. We must not erase or rewrite history or our code of ethics, lest we're doomed to repeat the greatest mistakes of humanity. We must end the abusive government third-party physician relationship before it ends us. We must make a choice. We can stay forever trapped in the dysfunctional system, enabling and feeding it, or we can get out and say no more. We will have to forge new paths and start over from scratch, but we can do it right this time for the good of our patients, our profession, our nation, and our souls. They can take everything away, but our minds and hearts, they cannot steal. Our skills, knowledge, experience, and code of ethics, they cannot take away. They do not possess what they peddle to our patients. We must opt out of government-run medicine. It's time to take responsibility. It's our choice. Make it. You're equipped. Use your talents. Find your role. fight for Team Hippocrates. Only we are qualified and equipped from one rite of passage to the next, virtuous, moral, not demoralized, not depraved. Remember, creed and deed, lead and weed, feed and seed, and repeat. Thank you for this opportunity. I feel very blessed to know each of you, and I look forward to a great future. Here's my contact information.